Even though we are doing an open castration, do not incise through the tunic. So you are initially doing it like a closed castration. Again, like a closed castration, break away the attachments at the caudal pole of the testicle. Keep the tunic intact, strip down the fat and exteriorize the testicle well. So now is the time we go through the tunic, transforming the procedure into an open castration. Break away the attachments. With this procedure, you could actually cut them. Usually, I place a surgeon's followed by miller's knot. With open, I never use crush beds, only with closed castration. The reason for this is that I believe the risks outweigh the benefits. The vessel and cord are very easy to close. And if you use clamps for crush beds, they could damage the vessels. The main risk for a disaster, apart from poor ligatures, is slippage or snapping. If the suture breaks, resulting on a tug on the vessel, it has been known to break and slip back into the abdominal cavity. This has then resulted in an X-lap to find the bleeder. This has happened a few times with new graduates. Work close in, so there would be less of a tug. If suture snapped or slipped, and also be aware of this, the main culprit is usually poor needle holders. Take your time and make sure those millers are tight, especially in larger dogs. Check for blanching and they look nice and tight. This is the tunic, cremator muscle, and cremastic artery and vein. Unligated, they can bleed inside the tunic, forming hard, painful swellings, scrotal hematomas. Suturing the edges of the tunic together. Most people assume if they have had a scrotal hematoma, it means their ligatures were not tight. Poor ligatures can be the culprit, but in the vast majority of cases, the hard, painful swelling is due to the muscle and vessel attached to the tunic. With open castration, the vessel that goes to the cremaster muscle is usually not ligated. What we do now is close off the tunic and ligate this vessel. This is the simplest way of doing it, by putting a millers around the tunic muscle and vessel. So we pull the tunic back and place a millers around everything. Testicular tunic, cremaster muscle, cremastic vessels. The other way to avoid scrotal hematomas is to perform a closed castration. So this side we will do closed. We break down the attachments at the back of the testicle and then strip down the fat. We can use the Alice tissue forceps to anchor the testicle. With closed castration, we use crush beds, usually straight mosquitoes or Carmalt clamp. Place the Carmalt, give 2 clicks, prepare a millers and then remove Carmalt crush bed clamp and tighten ligature in the bed and add about 6 singles. Keeping it fairly close to the first ligature, place the clamp again to form the crush bed. Form the second millers, remove the clamp, tighten and add 6 ones. Now we place a normal transfixing ligature. The Alice tissue forceps are removed, so when we squeeze the ovarian pedicle, we can identify the cord, muscle, and large vessel, and quite often the cremastic vessel is visible. Make sure you are tying the ligature around the vessel and not the muscle. At times they can look very similar, and to check, trace the vessel down from the testicle. Replace all the fat and tissue back, and as we made 2 cuts, there are 3 edges to close, top, middle and bottom. We close this layer with a continuous pattern, and remember to go the opposite way you go for intradermals. You can finish with a surgeon's knot or an aberdeen. Keep the tail short, otherwise it will be harder to hide the knot. To hide the knot, take a bite cranial to the knot, and then exit at the end of the wound, in the intradermal position. Now start the intradermal pattern, finishing with a surgeon's or aberdeen. I always finish with many throws, so my knot is longer, rather than being too square. It is essential to bury, otherwise it sits between the skin, not allowing the skin to heal. So in 3 weeks when the suture breaks down, there is a hole in the skin and the wound can break down. Pass the needle close to the knot. If it is a distance away, it will be 100% impossible to bury. If the needle glides through, then the knot should pass easily and bury, so if there is a lot of resistance, go again. Come out of the skin some distance away, and when burying, don't excessively pull on the suture. Use the adze and forceps to lift the skin over the knot.